A Lentulo Spiral is a fine filling instrument used to distribute root canal sealer throughout the depth of the root canal system during a root canal treatment. When a dental nerve dies off during the cutting of a tooth for a crown, due to chemicals or a deep caries, or perhaps overheating of the tooth, for example, then the dental nerve must be removed. This is done during a root canal treatment. First, the tooth is drilled open. Then the canals are prepared in a conical fashion with root canal instruments, while the root canal itself is rinsed intermittently. There will be more on that in the video by the same name. By rinsing with a special solution, as a rule the dentist will use sodium hypochlorite, chips of dentin and cell debris are removed from the canals. The overall goal is to obtain dry and clean root canals, a definite prerequisite for filling canals. Oftentimes, patients will ignore the toothache caused by the dying of the nerve tissue. In most cases, the pain does indeed subside after 2 to 3 days. However, the pain will flare up again after days, weeks, months, or sometimes even years. Often, such a tooth cannot be treated with a root canal right away. Imagine leaving meat sitting in the kitchen for a year. Thus, the dentist must first get the canal clean and dry. As a rule, he rotates a particular medication into the canal by using the Lentulo, and then attempts to perform the root canal treatment again approximately 1 week later. Here you can see a tooth that is protected against saliva and the tongue by a cofferdam. The root canal has already been prepared but couldn't be dried. This is often a sign that the infection at the root end is still active. There will be more on that in the video entitled Pulpitis. Now, the doctor uses a Lentulo to rotate the medication in and closes the tooth. A week later, this same process, in effect the rinsing and drying, is repeated. If the canal is clean at that point, it is sealed with a special paste. This procedure is referred to as the actual root canal treatment. More on that in the video by the same name. It's important that the instruments used, and especially the Lentulo, are sterile, because you don't want to rotate bacteria into the canal. Here you see a demonstration of how a root canal box containing the clean instruments is taken out of the sterilizer and unpacked. Unfortunately, the instruments are very strained by the sterilizing process. This is why they should be exchanged every few procedures. Old instruments can break far more easily. Here, on the X-ray, you can see a broken Lentulo that prevented treating the canal. An inflammation developed in the bone at the end of the root, as identified by the dark spot. In order to prevent such complications, the root canal treatment and the handling of the corresponding instruments associated with it require exact hygiene protocol to be followed. You can find out more in the video entitled Endobox.